Good morning, my name is Roxanne Canonoy. I will be performing Leopold maneuver from block 4. So good morning ma'am, I am your nurse for today. You can call me Nurse Roxanne. Can you state your name? So ma'am Maxipay, today we will do Leopold maneuver, which means I will be palpating your abdomen. Is it okay ma'am? This way, it is to determine the fetus position and presentation. Don't worry because it will not harm your baby. So Ma'am Maxpay, do you want to go to our restroom for a while because it might be uncomfortable later as we go on? The first thing I did is the cardinal rule, which means to empty her bladder to provide comfort. The next thing is to drape the patient to provide privacy. And next, I will be positioning the patient into the dorsal recumbent, slightly knee flex to relax the abdominal muscle. So I will only expose the patient's abdomen to maintain its privacy. Before I place my hands into the patient's abdomen, I already wash my hands and I will rub it together. This will provide warm hands because cold hands may stimulate uterine contraction. First three maneuvers, which is the Fundus Grip, Umbilical Grip, and the Pelvic Grip, I will stand at the foot part of the patient and facing the client. While the last maneuver, I will be facing the foot part. First maneuver, what fetal part occupies the fundus? Place your hands above the abdomen. Put your hands like this, like a triangle. Then put it on the top of the fundus. It is to determine the size, the consistency, the shape, and the mobility. You will feel it's either the head of the baby or the bottom. When palpating, a head is more firmer than the breech or the bottom. When you feel round, hard, it is the fetal's head, while the breech is well defined. Second maneuver, Umbilical Grip. Which side is the fetal back? Umbilical Grip. Put your hands on the side of the abdomen. The one will support and the one will palpate. We will do opposite later. It is to determine the location of the fetal back. When you feel smooth, hard, and resistant, it is the back of the fetus. We'll do opposite. When you feel nodular, it is the elbow or the knees. Third maneuver, Pelvic Grip. What fetal part lies above the pelvic inlet? Third maneuver, Pelvic Grip. Between thumb and the two fingers, put it in the lower portion. This will determine if the baby is engaged. When you feel round, movable, it is not yet engaged. When you feel like it is fixed and it's not movable, then it is engaged. Fourth maneuver, Pelvic Grip. Which side is the cephalic prominence? Maneuver, it is the Pelvic Grip. You will now face the client's feet and then put your hands on the lower portion of the uterus, then palpate it. It is to determine which side is the cephalic prominence. Palpate the fetal head by pressing 2 inches above the inguinal ligament. Do it on the other side. So now, Mama, explain. I'm going to check the heartbeat of your baby. Is it okay, ma'am? When counting the fetal heart rate, it is much easier at the fetal back. Use the belt at the stethoscope. Do it for a whole minute. The normal heart rate is 120 to 160 beats per minute. I will now cover the patient's abdomen. Now we're good to go. What I am going to do is documentation. I will document everything that I did and the findings I found about the Mama's pain were already done. Thank you for your cooperation because it became quick and easy assessment. Bye! So that's my video on how to assess Leopold's maneuver and fetal heart rate.